Your doctor has recommended that you have open heart surgery, and now the journey begins. In this program, you'll learn about this experience, your preparation for surgery, your hospital stay, and your recovery at home. By now you have had several tests, and your need for open heart surgery can be quite a shock. You have many questions. Your surgeon will talk about your surgery and what to expect. The heart surgeon's office will let you know that you will be receiving a call from a nurse from the surgery procedure call center to obtain some health history information. You will also be scheduled for an on-site visit a few days before your surgery. When you arrive at the surgery procedure call center, you'll be greeted by the secretary. You'll watch an informational video about your upcoming surgery experience, and you'll meet with a nurse. You'll receive a wristband, learn about coughing and deep breathing, and practice using an incentive spirometer. You'll learn about the importance of pain management and breastbone precautions, which will be vital after your surgery. The nurse will also provide practical information about parking, where to check in the day of surgery, and any additional tests you may have in preparation for your surgery, such as lab or x-rays. On the day of surgery, you will check into the surgical procedure check-in desk. You will then be sent to the surgical admit unit, where you will be prepared for surgery. You will meet many staff members who will be taking care of you. A nurse will review your history, listen to your heart and lungs, and start an IV in your arm.
I'm Dee. I'll be your nurse during the...
You will meet with the circulating nurse and the anesthesiologist, who are part of the surgical team. Your cardiac surgeon will also visit with you and your family. Your family will be able to spend time with you before surgery. When it is time for your family to leave, the staff will give directions to the waiting area, where they will be kept informed of your progress while you are in surgery. The anesthesiologist will place some additional IV lines, and soon you'll be off to the operating room. In what seems like no time at all, you'll be waking up. You and your family will be amazed at all the tubes and equipment, and the nurse will answer any questions you may have. You may feel cold and look puffy, but this is normal. A breathing tube will help you breathe. While this tube is in place, you won't be able to talk, but your nurse will show you how to communicate. You'll have pain medication to keep you comfortable. Soon, the breathing tube will be removed, and other tubes are usually gone by the next day, and you'll be sitting up in a chair. Within a day or two, you'll be transferred to the advanced care unit, where you'll stay until you go home. The nurse will show you the features of your room, such as the call button. Please call anytime you need assistance, and always ask for help when getting up to use the bathroom or to sit in a chair. A heart monitor will be keeping track of your heart at all times. The nurse will talk to you again about breastbone precautions and remind you to rest 45 to 60 minutes after each meal and activity. It will be important to ask for pain medication on a regular schedule so you can cough and deep breathe comfortably and move around. Friends can visit for short periods of time, but you will notice that you tire easily. You'll be able to shower daily with soap and water to keep your incision clean and dry. The nursing staff will start you walking, and each day you'll walk for longer distances. If you have stairs at home, your nurse will show you how to go up and down a flight of stairs safely. When you are discharged from the hospital, your family can have a car waiting for you. The doctor will advise you not to drive for 4 to 6 weeks after surgery. You'll be able to get into the car by yourself, and it is important to protect your breastbone as you are seated and make sure your seatbelt is comfortable and secure. If you have any long distances to travel by car, you'll want to stop and walk around for a few minutes every 45 to 60 minutes. It will feel good to be home. In the first few days, you won't feel like doing too much, but it's very important to get up and move around. There are 3 major considerations for healing and recovery after surgery: breastbone precautions, healing of your incision, and progression of your activity. While your breastbone is healing, it will be important not to lift, push, or pull anything heavier than 5 to 10 pounds for 6 weeks. The most you should lift is equivalent to a gallon of milk. Try to use your arms together as much as possible, especially when reaching for objects above your head. Avoid strenuous activities like vacuuming, mopping, heavy yard work, or anything that requires vigorous use of your arms. You should look at your incision daily, and it's important to always wash your hands before touching this area. As it heals, the redness and swelling will decrease. Daily showers are recommended for about 6 weeks. It is helpful to have a family member there to help you as needed. You can wash your incision with mild soap and water and gently pat dry. You should not apply lotions, oils, or vitamin E or antibiotic creams unless directed by your doctor. As your incision is completely healed, you can use moisturizing cream or baby oil for itching. It is very important to call your doctor for any signs of infection, such as increased drainage or pus, increased swelling, and increased redness or pain. Getting out of bed those first few days can create a little anxiety. Someone can assist, but they should not pull on your arms. It is vital to gradually increase your activity to prevent complications. Walking helps you to gain strength and helps your lungs to clear. Start with 2 to 3 short daily walks and walk at a comfortable pace, which will allow you to talk without feeling or sounding breathless. Keep track of the number of minutes you walk each time and add a minute or more every day as long as you feel good. Gradually build up to a 40 to 45-minute walk if possible. If you have any symptoms such as shortness of breath, dizziness, lightheadedness, a fast heart rate, cold sweats, or excessive fatigue, you should stop, rest, and return home. In the first few days at home, you may be anxious about your recovery. You can be left home alone for short periods of time. You may experience common problems such as decreased appetite, nausea, slower bowel activity, or sweating during the night. Some people experience insomnia, an inability to concentrate, or bad dreams. You may experience emotional and physical ups and downs, and it is helpful to share these feelings. You should wait a few weeks before resuming any sexual activity. When you resume sexual activity, be careful to protect your breastbone. In addition to your activity at home, you may want to join an outpatient cardiac rehab program. Talk with your doctor about this option and any other questions you may have about your recovery. You will have a follow-up appointment with your surgeon about a month after you go home from the hospital. Since it takes about 3 months for the breastbone to completely heal, this is the time to ask when you can resume more strenuous activity. Notify your doctor if you have any drainage, increased tenderness, redness, or swelling in your incision. A temperature of 100 degrees or higher. Breastbone popping, clicking, or movement. Nausea, vomiting, diarrhea, or constipation. Weight gain of 3 pounds or more in a 24-hour period. Any angina or heart discomfort other than incisional pain. Persistent or increased swelling in your feet and/or lower legs. Having open heart surgery is a big challenge in a person's life. The road to recovery is hard work, and with help and support, you'll make steady progress at getting back to a healthy life.